In this video, I'm going to show you how to relieve hip arthritis pain in 30 seconds. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to focus on quick hip pain relief being caused by osteoarthritis. That is the wear and tear arthritis of the hip. And we're going to do this by lengthening and strengthening everything in and around the hip. To make it easy, I'm going to split the video up into different parts. Each part will focus on a different area of the hip. That way you can easily target the spots that need it the most. And we're also going to focus in the later part of the video on strengthening, so do not miss that part. It's the most important one. All of these exercises can be done at home. They require no equipment and may give quick hip pain relief even in as little as 30 seconds. So let's get started and fix that hip pain right now. In this part, we're going to focus on hip pain on the outside of the leg and thigh by targeting hip AB or abductors. This is known as the clamshell combo. If your mattress is firm enough, you can do it in bed, but you can also do it on the floor. You're just going to lay on your side with the painful side up towards the ceiling. Support your head with your hand just like this. The movement is very easy. My knees are going to be roughly at 90 degrees. I'm going to push my feet and heels together, also down into the bed or the floor for a stable anchor point. Take your hand, put it right on your hip. What you're going to do with this top leg is just swing it upward like this, taking the knee back as much as you can. Really focus on moving through the hip and through the waist. When you do this, you're going to feel a lot activate on the outside of the hip. That's the hip AB or abductors. You want to go up as far as you can and hold this for about 3 to 5 seconds comfortably. From there, slowly come back down to the starting point. You just want to do this one nice and slowly for about 10 to 15 repetitions. And with each repetition, try to bring that knee back even further. After that, take a breather. If you feel like you have a little bit more energy, you can throw in another set or two. And I do recommend that when you're done on one side, switch to the other to keep them both in balance. This is how you can take it to the next level if the clamshell is just a little bit too easy. So instead of having the top knee bent, straighten the leg completely away from you. With this one too, you want pretty much from your shoulder to your hip to your knee to your ankle in a nice straight line. Again, I'm going to stabilize off to the hip. This time around, I'm going to just lift my ankle and foot upward towards the ceiling while keeping my legs straight. You're going to feel a lot happen on the outside of the hip. So go up as far as you can. Again, hold this one for about 3 to 5 seconds. You're just going to relax and then repeat this one 10 to 15 times, throwing another set or two in as needed. But you can even take this one to the next level by incorporating a little bit more dynamic movement in there with it. We call this one the outer hip arc. So instead of going straight with it, take your leg back very slightly and repeat this process. You're going to notice that it hits the muscles just a little bit differently. So experiment with going all the way back and then work your way forward doing the same thing. You're going to notice that one certain spot, one certain angle really just hits those muscles, that hip, a little bit more. You want to focus on that, throwing more repetitions in because you're addressing weakness that might be causing your hip pain. But again, when you're done on one side, switch to the other to keep them both in balance. In this part, we're going to focus on inner hip pain, including towards the inner part of the thigh and the groin by targeting hip AD or adductors. This time around, you are going to have the painful side facing downwards. Again, you can do this one in bed or on a floor. So what I'm going to start off with is just supporting my head like this with my hand and then having my body in a nice straight line. Again, painful side towards the bed. I'm going to take the top leg right here, bend the knee, and then bring my foot over the painful side and press down into the bed or the floor for a little bit of a stable anchor point. You can take your hand and grab at your knee or at your hip, whatever's easier. But this one, we're going to treat the bottom painful side kind of like a board. You want to keep it nice and straight. You're just going to simply lift upwards with your leg like this towards the ceiling as far as you can. You're going to feel a ton activate in the inner part of the leg and that hip. Hold this one comfortably for about 3 to 5 seconds. From there, you're just going to relax. You want to do this for about 10 to 15 times. With each repetition, challenge yourself to build into it just a little bit more. From there, you can take a breather. If you have some energy, you can throw in another set or two. But what I can do to take this one to the next level is incorporate more dynamic movement into the exercise to target that inner hip just a little bit more. So let's take the non-painful side, and this time around, bring our foot backwards, press down again for stability point. Instead of going straight with it, just bring your leg slightly in front of you and then repeat this exercise. You'll notice that it hits the hip just a little bit differently. And I try to do this one for a couple repetitions, and then I move even further away. You're going to do a complete arc, going out as far as you can with it. You're going to notice that one certain spot might be a little bit more challenging, or it's just really hitting that hip pain the most. That's where you want to stop and throw more repetitions in. Always focus on the spots that need it the most. But it's a good way to really pinpoint tight, achy spots. And I do recommend that whatever you do on one side, to do on the other to keep them both in balance. In this part, we're going to focus on anterior or front-sided hip pain by focusing on the hip flexors, which tend to cause a lot of pain in the front part of the leg towards the hip and groin. This one is known as a frog rocker. You can do it in bed or on a floor. Just start off on all fours just like this. What we're going to do is put our feet together and then slowly slide our knees outward as much as we can until you feel a deep stretch in the inner part of the thigh towards the groin. From there, I'm going to tuck my chin towards my chest. The movement is very easy. I'm going to rock my whole body backward, kind of like taking my butt down towards my heels. The more you go down, the more intense of a stretch you're going to feel in the legs, into the hips, across the pelvis, even the lower back. Hold this right here for about 15 to 20 seconds. From there, we're going to do the opposite. We're going to go forward as much as we can. You'll notice it hits the muscles a lot differently. You're going to feel a very deep stretch in the front part of the leg, those hip flexors. Again, hold this one for about 15 to 20 seconds. And then from there, you can take a breather. But I try to do this complete cycle for about 3 to 5 repetitions. And with each repetition, try to stretch into it just a little bit more. So here's a really easy way to help improve hip rotation with an exercise I call windshield wipers. You can do this one in bed or on a floor. Just lie on your stomach, prop yourself up on your elbows just like this. So whatever hip that you're focusing on, what you're going to do is bend the knee roughly at about 90 degrees on that side. The movement from here is very easy. I'm just going to start off by taking my foot outward as much as I can. This puts the hip into internal rotation. And the key with this exercise is to move through the hip only. Don't try to turn through your waist or through your back. All movement through the hip. But go as far as you're able to go. You should feel a lot of muscles activate in and around that hip. I hold this one comfortably for about 5 seconds. I'm just going to relax, and then I'm going to go in the opposite direction, going inwards with it and taking that hip into external rotation. Again, holding this one for 5 seconds. From there, I'm just going to relax and then just switch to the other side, and I'm going to repeat this. You want to do this one nice and slowly for about 10 complete repetitions in both directions on both sides. And with each repetition, always try to stretch into it just a little bit more to activate those muscles and hopefully get more range of motion out of those hips. When it comes to hip arthritis, your main focus should be building strength and stability in and around the hip joint. That way you can get pain relief, but also help slow the progression of that hip arthritis. I'm going to go over 2 separate exercises that may help us with this. The first is known as the 3D dead bug. It's a great exercise that's going to hit a lot in a little amount of time. You can do this one in bed or on a floor. Lie flat on your back. What you're going to do is lift the legs up like this, hips, knees roughly in a straight line. Your knees are going to be bent roughly at 90 degrees. My hands can go on my hips or off to the side for a little bit more support. But the movement is easy. I'm going to take one leg and then just lower it down, straightening my knee. The key with this one is to let the leg hover above the bed or the floor. Don't let the back of the leg touch. In this position, you should feel a lot of muscles firing. The core, the back, the glutes, and the legs. Everything that helps build stability around that hip. Hold this position for a couple of seconds. From there, I'm going to take it to the next level by taking my leg inward as much as I can. The more that we go inward, the more that you're going to feel a deep activation of the muscles on the outside of the leg and the hip. From there, I'm going to even further this by taking my foot and turning it inwards just like this. You'll really feel a lot of fire around the hip. Hold this for a couple seconds, and then from there you're just going to relax and then take the leg outward as much as you can. This time around you're going to feel it more on the inner part of the leg and the hip. Once we feel that deep activation of the muscles, we're going to then take the toes and the foot outward as much as we can. This one feels really, really good. Again, I just hold this for a couple of seconds. From there, I'm just going to go back to the middle and then relax and take a breather. On the next repetition, try to build into it even more. Stretch more into these movements, and you can also hold them for longer. The longer that you hold it, the more it's going to challenge those muscles. That's the key. Always challenge yourself to build strength because you'll end up getting better results. But I try to do this whole complete cycle nice and slowly for about 5 complete repetitions. And then when I'm done on one side, I just switch to the other to keep them both in balance. This exercise is what I like to call the planking bridge. It's going to put a little bit more focus on the glutes and the buttocks, a big stabilizer of the hip. This one can be done in bed or on a floor, but it's probably easiest to do on a floor. What I'm going to do is start off lying on one side. You want your whole body in a nice straight line, knees bent roughly at 90 degrees. Support your upper body on your forearm like this. The other hand is going to go right on the hips. The movement from here is very easy. I'm going to drive my hips upward towards the ceiling as much as I can. So you're supporting yourself on your forearm and your knees. The more that you go up, the more that you're going to feel muscles on the side right here, the bottom side, start to activate. I feel it going off to the side, into my lower back, through my pelvis, and more importantly, into my hip. Really focus on feeling it into the hip. We want to hold this one for about 5 seconds. From there, you can relax, take a breather. On the next repetition, try to drive up even more. You want to do this one for about 5 complete repetitions. And when you're done on one side, switch to the other to keep them in balance. You can throw in another set or two to make it more challenging. But I'm going to build into the bridge next. So I'm going to lie flat on my back. What I'm going to do from here is have my knees bent, my feet are going to be flat, legs hip width apart. Take your hands, put them on your hips. The movement, again, very easy. I'm taking my hips, driving them up towards the ceiling until I have a nice straight line from my knees to my hips to my shoulders. If you're unable to get into this position, let's say you can only go up an inch or two, do the best that you can. Over time, hopefully you'll gain strength and flexibility to get into this position. But I feel a lot firing. My core muscles, lower back, the butt, the legs, everything that helps support those hips. I try to hold this position for about 5 seconds and then just relax. And then I'm going to repeat this up to 10 times. With each repetition, try to drive up just a little bit more and activate those muscles. To make this one more challenging, you can just lift one leg up like this and put all of your weight on one side. But whatever you do on one side, just make sure to do on the other. So give that one a try also. You can also do a different variation of the bridge known as the clamshell. So what I'm going to do is take my feet, put them together just like this and press inwards for a little bit of a stability point. Take your knees outward as much as you can until you feel a very deep stretch happening in the inner part of your legs, into the groin, into those hips, and then slide your heels towards your butt as much as you can to get a little bit of a deeper stretch. The movement is the same from there. Take your hands, put them on your hips, and then drive the hips upward as much as you can. You'll notice that it puts a little bit more emphasis across the hips. So give that one a try. If you feel like it gives you better results, throw more repetitions in at that point. But go through all of these motions and use what gives you the most amount of relief. If the exercises helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.